What's your definition of regular? I've asked you a very simple question. Why are you trying to build a mountain out of a molehill?
It's a usual thing. You people ask a lot of questions, so I'm used to answering this question. I don't see anything wrong with the way I answered.
Okay, if you are not ready to see the doctor, I think you can walk out. I have plenty patients waiting to see me. If you cannot define why you are here, you can walk out of my consulting.
Well, even if you say I should walk out, if I cannot receive the treatment from you, God will take care of me. I'm going. Let me go and tell my family that.
What we have been doing for the past 2 days now is we are doing a national diabetes educators workshop. And in this workshop, we are training all categories of health workers, doctors, nurses, lab scientists, dietitians, and even other diabetes educators to empower them to acquire more knowledge and skill so that they'll be able to dictate diabetes and manage it effectively.
This increasing incidence and prevalence of diabetes mellitus is the attendant health implications, the increase in occurrence of complications of diabetes. And we're talking about a health system that is not so strong to support the care of these patients. If we continue at this pace unchecked, it is likely that our population is going to graduate from just a mere epidemic to a pandemic of a non-communicable disease.
The truth is that in Africa generally, particularly sub-Saharan Africa, the government is not really doing much in terms of non-communicable disease control. Most patients in sub-Saharan Africa, they pay from their pocket to get treatment for diabetes, hypertension, sickle cell disease, and other non-communicable diseases.
There are some NGOs who have tapped into foreign agencies, okay, who have been able to receive support, either in cash or in kind, to continue to implement their NGOs here in Nigeria. Go to rural areas, identify people who are diabetic and in need of insulin. But diabetes is not a single disease. Blood pressure and diabetes are complementary. You hardly see somebody who has diabetes without having blood pressure. And if that is true, then we have to, while we are taking care of people with diabetes, giving them insulin, we will also take care of their blood pressure level. We will also take care of their cardiovascular problems. We will also take care of their cholesterol level and so many other things. And I hope some meaningful people who have passion, who are compassionate enough to remember this group of people will come into the fore to help us.
This training really is timely. The caliber of people that we are invited for this particular training will have an impact on general of populace because they are the first contact, be it in the hospital, be it in social gathering or anywhere.
As a dietitian, I really learned a lot. Here, they've talked about the dietary management of diabetics, and they have gone extra miles to see how we can handle the diabetic patients with even the local food that we have here.
Coconut, the back of coconut, or this coconut, the back, when you pick it and suck it from the husk, when you take it, it brings down blood sugar.
This workshop is most timely. We are focusing on diabetes education and prevention because for diabetes education and prevention, for the patients, he needs empowerment so that he can self-manage. Because diabetes is an illness where self-management protocol is part and parcel of it. So there are patients here who are part of this workshop. Now for the healthcare provider, they need to update their knowledge and skill. Yes, so that evidence-based recommendations can be put in place. And we are giving them evidence-based recommendations. And this also has been packaged in our guideline for management of diabetes, which is being distributed. And this guideline is printed courtesy of Olusegun Obasanjo Foundation.
The foundation is here today to see what we can do to move this forward. Not a one-stop shop to say, oh, it's International Diabetes Day, let's just come and celebrate it. But also to look at how can we work with people like yourself to improve the life and quality of life of people living with diabetes. Their innovative way of looking after ourselves, eating properly, healthy food, lots of vegetables in your diet, also taking care, doing lots of exercise. A lot of people forget that the basic necessity is not about the drug you take, but about what you can do to prevent it.
Most of us that came are involved in diabetic care. I wanted to remind ourselves of those things we know and those things we're supposed to know. So when we go back to our stations, our various facilities and centers, we're able to impart that knowledge to other doctors, other nurses who are not privileged to be here with us. So I think that is so important because by the time we disseminate the information, it's so critical in the management of diabetic patients.
So far, with what we have seen, we are impressed because there are participants from all the states of the Federation gathering in Abuja, the center of unity. You know, we have over 100 people participating in this workshop. These are the frontliners in healthcare delivery. So by the time, and we are, as part of this workshop, we have practical sessions and take-home message. So that by the time they go to their states, they are going to step down the training. So that if the average rural dweller living with diabetes will be positively impacted.
My good people of Africa, I have very few things to say. Yesteryears, diabetes did not feature in our disease pattern. Something has changed. We have abandoned our good old practices. We are acquiring under the guise of civilization, urbanization, development, etc., etc. For years, our eating patterns and our dietary habits and everything sustained us in a non-diabetic state, in a non-obese state, in a less hypertensive population base. We have no information on cancer. But these three non-communicable diseases that are so prominent on our arena are recent and it's been linked up with so many things which we have abandoned or we have erroneously taken up, and I think it's bad. But we have identified them. It is left for us as members of the healthcare professional and the general community to make sure that our populations are aware of these factors so that they can move with us in anything we suggest that we think will be of benefit to the health and well-being of our community.
We thank Obasanjo Foundation for giving us the opportunity to attend a program like this that is good even for the doctors, all other medical practitioners, and even to us who are with diabetes, because this program will benefit us a lot.
I want to really show my appreciation to Diabetic Association of Nigeria at the national level, and also to the Obasanjo Foundation for really putting heads together to organize this type of seminar.
When you manage it very well, having diabetes is never a death sentence, and you can even do anything you want to do in life.
Training us now, and we are going to go back to retrain people who go a very long way in Nigeria, and it will make us to have a vital role to play in patients' life.